This video will give you an idea of how the ReCODE program works in our clinic. I'm Dr. Mike Powell, and the program here at our clinic is based on the training from Dr. Bredesen and from the Institute for Functional Medicine. It's a one-year program, and the way we get started is you contact our office, and then we set up a time for us to meet here in the clinic, or if you're significantly out of the area, we can do it over the phone, and then discuss both the program and your specific situation. If we both decide it's a good fit, then we get started. The next step is that we order extensive laboratory testing, we do some additional cognitive testing, and we gather more in-depth information on your health history. Once the laboratory results are back, I combine that information with the other exams and your history with the goal of identifying what is the primary cause of cognitive decline in you. And so I'll identify that cause, or maybe a secondary cause as well, and then at that point you'll return to the clinic and then we'll get your plan started. That time when you come back to the clinic, that's actually day one of your one-year program. We discuss those results, and we discuss specifically what steps need to be implemented to, first of all, change the environment of the brain to one that will support healthy neurons instead of one that's encouraging neurons to degenerate and decrease in their function. We'll get those steps put in place on that clinic visit. At that point, you'll initiate your program at home, and every 2 weeks we'll either meet in the clinic or we'll meet on the phone and make sure that things are progressing according to plan. After 4 to 6 weeks of implementing your program, we'll be looking for indications that the environment of the brain, whatever those causes were for you, inflammation, blood sugar regulation issues, toxins, whatever it might be, we'll be looking for signs that this is changing. And at that point, if it looks like the brain is an environment that's one that promotes connectivity between neurons instead of degeneration, then most likely you'll get started on some brain-based exercises that specifically target areas of the brain identified in you as being weak ones. At the 6-month mark, we'll repeat your brain function tests along with any of the abnormal blood tests. And at that point, we'll be able to establish a yardstick as to where you're at in the program. Most people are starting to notice improvements at the 6-month mark. After this, we modify the plan if needed and implement any new strategies that are next steps in our journey to reverse cognitive decline. This will continue through the next 6 months, and we'll continue that accountability of communicating and meeting back and forth on a regular basis to make sure each step is being implemented properly. At 1 year from starting the program, we'll run the tests again, and at that point, we'll determine what level of improvement has been achieved and what the best long-term strategy is moving forward. I'd like to share an example of a patient that's gone through this process to help you understand our program better. This example is a 70-year-old man, and he's a business owner, but he's got a 12-year history of some memory issues. Having a hard time remembering names, he's having a hard time with his schedule, oftentimes forgetting where things are at both at work and at home. In addition to that, he's got a sleep disorder, and in order to get decent sleep, he's been prescribed Ambien. It's kind of interesting, both having a sleep disorder and use of Ambien can be associated with cognitive decline. So that'll be an issue that we'll want to consider as well. This fellow can't run his business anymore and has a hard time really working in it in any way that he would like to. Cognitive tests and imaging confirm a diagnosis of Alzheimer's disease. He then went through the ReCODE program, which started with brain function tests as well as extensive blood work, as I described earlier, and the primary causes were determined to be inflammatory with some contribution from a lack of signaling hormones. So he starts a year-long program that's focused on addressing basically 8 factors. So first of all, he was put on a ketogenic diet that removes carbohydrates basically from his diet, lowers his protein intake, and really increases his healthy fats. In addition to that, a 10-3 eating program was also established. And what that means is that each day he would eat during a 10-hour window of time. For example, he would start eating or consuming calories at 9 a.m. and then eat until 7 p.m. He'd stay within the food parameters that were set up for him, but he would only eat during those 10 hours. The 3 refers to that he would not eat in the 3 hours before bed. So basically he's feeding for 10 hours and fasting for 14 hours. This promotes a process called autophagy and is a common strategy in many people in the ReCODE program. Third thing, medium chain triglyceride oil was added to his diet. That helped with the ketogenic activity, and increased fiber was added to his diet. Fourth thing, he was started on a program to improve his gut function and kind of heal up his gut wall. That actually was started a little bit later in his progression, in the second 6 months. Fifth thing, several supplements were added to his regime based on his blood tests. Those were zinc, he had several vitamins, and he also had some antioxidants that are anti-inflammatory for brain tissue. Okay. Sixth thing, he started some brain-based exercises in about the second month of his program. They were specific for his right temporal and right parietal lobes. Seventh, aerobic exercise for 40 minutes, 6 times a week was added to his program. This was a gradual progression. He didn't start with 40 minutes right away, and it was done with a heart rate monitor and several other parameters to make sure that he was within a level that he could tolerate. But he got up to 40 minutes 6 times a week within a few weeks. And then the last thing was that his sleep was addressed. Working with his prescribing physician, he was taken off Ambien, and basically with the other things that were implemented, the exercise, the diet, he lost some weight. He was able to get 8 to 10 hours of sleep at night without the Ambien, basically just with the other parameters. These were some of the basic things that he did, implemented at different points for that 1-year program. At 6 months, his wife was reporting improvements, and he was fully back to work in his business. At the 1-year mark, neurocognitive testing was repeated, and he no longer qualified for a diagnosis with Alzheimer's disease. Each of the 8 main parts of his treatment were determined based on his test results, and then that identification of inflammation and signaling chemistry as the main causes of his cognitive decline. So each of those were individually picked for him and for those specific causes. Although your care might have some similarities to this man's, it will be individualized based on your specific needs and your specific test results. I hope this gives you an idea of what's possible and how this process works. If you're interested in the ReCODE program for yourself or someone you care about, please contact us at our clinic.